In my case, as you know, I came to see you because I was aware that hearing loss can affect all kinds of things, cognitive and whatever else. And when you tested me, I'm borderline. At what point do I stop being borderline? I'm going to rely on you to tell me, but I only came because I knew, because of Len's experience, what hearing loss can do. So it's very interesting. I mean, it's that judgment of when you need the extra help. And having done the experiment with you and then being aware of me in social interactions, I do still mainly, I would say nearly 98% of the time, hear what's being said unless I'm in a very loud environment. Well, I think it's something that creeps up on you without you actually being conscious of it. And whilst one might hear in most situations, that there will be situations that obviously you don't. And I think that we're kind of conscious of the ones that we do hear in and not conscious of the ones that we don't.
Your hearing's doubly important because I often say to you, what did he say?
And I'll say, I really wasn't taking any notice because actually it was boring.
You talk about coping strategies, but even now, I'm not going to spoken word theatre. Musical theatre is okay, but spoken word theatre, because most theatres now don't really have a satisfactory hearing loop mechanism, and I'd be lost in a theatre where words are so important, and the meaning of these words are so important. So I'm still not doing that, but hopefully more and more public places will get hearing loops, or there's this thing called Ori, which I saw the flyer for the other day, and I don't know anything about it, but you will at some point tell me all about it, I'm sure. But yeah, so there's still things which I can't do, but it's more non-coping mechanisms. So it's otherwise not going to the theatre, not going to a loud restaurant, not going to eat on a Saturday night, for example, but going out to dinner on a Wednesday night because you know the restaurant's going to be quieter. And it's that sort of mechanisms that you adopt without, almost subliminally. You're not sure, you don't realise you're doing it. I first noticed it in another aspect of my profession. I was organising educational programs for one of the local private hospitals, and in that organisation I was chairing, and at the end of a specialist's talk I would look for questions from the audience, and I noticed that people were talking much more quietly. I think these blinking people at the back, they're sitting at the back and they think they're just talking to their next door neighbour, and I couldn't hear what they were saying. Then I realised that actually the person standing next to me, who was the lecturer, actually could hear what they were saying. So that's when I decided I needed to do something about it, with a mental apology to all the ladies that I told off for not talking loudly enough. So that was, must have been about 20 years ago. 25 years ago. So then I went and had my hearing tested, and I went to the local district general hospital audiology department, where they fitted me with one hearing aid. They said, well, there's minor hearing loss on one side, a bit more major on the other, and that really threw me. I could hear myself talking, I could hear myself eating, and in fact I took it out more often than I had it in, and just left it. I couldn't be bothered with it anymore. And that was for a few years that I did that, and I'd stopped doing the educational program, but I found I could cope on a one-to-one basis within the surgery without any background noise. Often I would have to ask patients, excuse me, can you just repeat that? I didn't quite catch it, and they would. And they talk a bit louder for about a minute, and then they revert back to their mumbling again. And at the same time, I was feeling tired. I was also going through a divorce at that time as well, and I don't know if the hearing loss had any impact on the divorce. I don't think it actually did. And then I met Jenny, and I remember very clearly, I'd stopped wearing the hearing aid, by the way, at that point. After a year or two, I was having a meal with Jenny and her daughter, and the daughter looked and said, for goodness sake, do something about your hearing. I didn't realise she'd been talking to me.
You didn't hear?
I heard her when she raised her voice, but it's because I hadn't heard the question she just asked me. So I said, well, there's no point going back to the District General, so I took myself off to Gray's Inn Road, to the Royal National Throat, Nose and Ear, which was in Gray's Inn Road, it is no more. And they fitted me with a better hearing aid in both ears, but on the basis just a very basic, pure tone audiometry. And that was okay, but I was still missing things. I could still not hear very much, and then decided I would ask a couple of eminent ENT surgeons, where should I go? The first one said, learn lip reading. The second one said, go and see Adam and Cubex. Literally, that's actually what happened. I'll tell you later which was which. Okay, I think you know both of them. And then I came, and for the first time, I was treated rather as a person, and not as a case of deafness. And there's a very great difference between that. You have a very, very personal attitude in the way you teach, the way you treat people, and that's down to you. I think that's a very personal thing. So I'm complimenting you on that. But at the same time, you also did testing on me, which I hadn't been tested before, with background noise testing, understanding phonetic syllables, these various tests. And so I had the feeling that you were actually really properly fine-tuning my hearing needs at that time. And I think we tried one or two different hearing aids, and then finally settled on the one, and there was a significant difference. And you taught me to realise that actually I'm never going to have perfect hearing. There's no point in thinking that I can hear everything. And when there's a lot of background noise, I know I will not pick things up, and I don't expect to. But you've organised the various programs on my hearing aids so that I can maximise the chances of me picking it up, although they're quite subtle, the changes that happen there. So it has made a significant difference. And one of the things that I was feeling was very tired before the hearing was properly rectified. I'd fall asleep sitting in the chair, 8 o'clock, 9 o'clock. And then that got better, a lot better, when the hearing was better. And I soon realised that I couldn't actually work as a doctor without my hearing aids. It just would not be possible. And so you've actually prolonged my active life, like the old dog food advert. Okay. Which is a great thing, because I enjoy what I do. I enjoy my profession. And that's basically my story.
I've never had a problem with his hearing loss because, fortunately, for Len and for myself, it's never a problem for me to project my voice, because I did singing training. My daughter Jess, who was the one that said, "Oh, for goodness sake, Len, go and get your hearing sorted out," also had the same training. So I think that Len could hear us quite well. It was in other situations where he couldn't hear. So there wasn't the normal frustration that there might have been in the interaction in families and things like that. The tiredness was huge, and Len didn't realise that. And funnily enough, even now, if, for instance, his hearing aids, before he had permanent charging ones, the batteries went, and he just wasn't in a situation where he could change them, he would become really tired. And I don't know if you were aware of that, but it was certainly the case.
Switch off.
Yeah. So that, I would say, is probably one of the major factors for him. Also, he was less, anxious is the wrong word. he's never really enjoyed large parties and things like that. Neither do I particularly. But he was much more at ease after he had his hearing aids, even with the increased hubbub around him, because he knew that if somebody was standing opposite him, he would be able to understand what they were saying without turning to me and saying, when somebody's attention had been taken, what did he say? Did I miss that? Did I interpret wrong? Am I smiling in the wrong places? Because I think that for a lot of the time he was kind of guessing what people say, or lip reading without realising that he was actually had the ability to lip read. So it's very interesting how much life changes when one acknowledges hearing loss and does something about it.
Yeah, I think my training in medicine has taught me lots of non-verbal clues. So a lot of my responses in a background noise situation have been based upon my computing what's being said to me rather than what I'm hearing. Now with the refinement of hearing aids, I'm able to conduct one-to-one conversations with perhaps the person next to me or opposite me. Still, I can't conduct a conversation with the person at the other end of the table if there's background noise. So there are limits as to what I can do, but it's still much more enjoyable for me now than it used to be 10 years ago, whatever. Yeah. I looked up earlier on how long I've been coming here, and it's been 12 years. 12 years. Well, it'll be 13 years in the summertime. Yeah. So, yeah, it's a long time, big chunk of my life, and I'm very glad I made the decision to come here. Yeah, and having experienced the difference that having rectification of my hearing, or partial rectification of my hearing loss, you begin to wonder whether or not actually it should be part of a national screening program, say at 60. I'm just using that age as a plucked out of the air kind of age, because there's more and more evidence about hearing loss and cognitive impairment leading on to dementia, and how that dementia can be actually delayed significantly by addressing the hearing loss. And so I wonder whether or not there should be some program, even if it's just pure tone audiometry, nationally. As people have their blood pressures checked, ladies have cervical smears, there's all sorts of national screening programs.
But this sense seems to be one of the most ignored. I'm sitting here thinking, what am I waiting for? Yes. So, yes, I'm a convert.
So we can have matching charges on both sides of the road.
Absolutely, yeah. Except I'll have pink, so it'll be different from yours.
I'm sure Adam can get a big charge.